Hello, welcome to CIO Leadership Live Middle East. My name is Andrea Benito, editor at CIO Middle East, and today our guest is Vinit Purusothaman, Group Chief Information Officer at Aster DM Healthcare. Hello, Vinit.
Hi, Andrea. Pleasure to be on the
It's our
interview with
pleasure
you.
to have you here today, and let me say congratulations because Vinit has been one of the top CIOs in our award, CIO 50, and also you won the category Leadership in Innovation for your outstanding job at Aster DM. So many congratulations.
Thank you. Thank you so much. Thank you
And
so
thank you
much.
so much, as I say, for being here with us. Well, first of all, I would like to start with asking you this. I know you answered to this question so many times, but the last years have been crazy for any hospital in terms of health, but also digital strategy. So, how the pandemic impacted the healthcare in the UAE, and how the pandemic has changed after the end digital transformation plans?
Thank you so much, Andrea. Thank you. Uh, the I believe the pandemic, and I've told this multiple times, the pandemic has been a catalyst or an accelerator to all the digital transformations that were happening in the healthcare industry. Uh, all around, I believe healthcare as an industry was a bit behind when it comes to technology adoption, technology usage, compared to the other verticals like a retail or a banking or a manufacturing. But uh, the transformations that happened from 2018 and into 2019 and 2020, that's when the pandemic hit us, has accelerated the whole transformation several times. And that's why I said it's a catalyst. It played the role of a catalyst. So yes, so healthcare is one of those verticals where the changes that have happened during this period has uh, helped us not just to understand new revenue models and but to see how the whole technology and digitization can help us serve our patients better, but also shown us that technology is one way uh, to make the healthcare services affordable and accessible. Both are very key words when it comes to healthcare, right? If you're able to reach the maximum people and to ensure that every person who's in need of care has got a doctor attending to them, that will be the best scenario. And then obviously at an affordable price, because we live in a world where not everybody can afford quality healthcare. So we at Aster has been driving this mission of ensuring that we provide healthcare across all the places that we operate in, that is across 6 countries, and also to ensure that we provide quality healthcare at an affordable price. So that's what technology has done in the last couple of years, and that's what me and my team been able to provide to ensure that we have a technology platform. We are able to drive the healthcare services
I wanted to,
across.
yeah, I wanted to ask you about that. You were talking about the right care, taking care of. It's not customers, it's patients. And I know Aster DM has been focused in automation. I know Aster DM wants to ensure the patient is getting the right care. And as you say, it's not about automated something. It's live. So why automation matters? What extent is the hospital automating? And what does it mean for the patient at Aster DM?
Yeah, that's a good question because when you talk about automation, like you correctly pointed out, it's not just about automating every process. It's not necessary that you automate every process, but it's also important to continuously look for opportunities and process that can be automated. But that automation, that decision on automation has to be done based on what does the automation do in terms of outcome. So when you say in a hospital, we can talk about automations within the hospital and outside the hospital. I'll say that broadly, the whole healthcare as a service or healthcare as an industry operates in three major divisions, major areas. One is obviously before before the hospital or a pre-hospital care, which is it's about all the preventive health checks, about ensuring that everybody stays healthy. That is by good lifestyle habits, encouraging health as a priority, and working with your patients and customers to ensure that they take care of the health, and we
Mhm.
as Aster enable that process. That's one. Then obviously is okay if you finally fall ill and you need attention, it is the in-hospital care, right? And that's where we all normally operate. All the hospitals, the clinics are all about in-hospital care. That you walk in and get taken care of, whether it is by where a doctor looks at you, or whether you get hospitalized and you go through a treatment. And then comes the third part where you get discharged, and that's the post-hospital care. Very similar to the first one, but then post-hospital care could also lead to saying that okay, once you're discharged, you come back for visits, you come back to meet your doctor. Can technology play a role there to say that once you are outside the hospital, once you have been discharged, you go back home, but you still have the assurance of an Aster taking care of you, looking at you, doing remote care, where you're able to reach out to the doctors and get that assurance. You and your relatives can get the assurance that yes, you are still under in safe hands. And that's the real crux, because if you are able to provide technology and care and put technology and deploy technology to ensure that a care provider like Aster are able to cover these three aspects: pre-hospital, in-hospital, and post-hospital. That's what makes the difference.
Also, we need. What do you think that how Aster DM Hospital will be in the future, meaning short time, and what technologies will be the key for this future?
So Aster has been a leader when it comes to this particular region, and even in India, we are one of the pioneers. But we are also known for being leaders in technology deployment uh, and and driving innovations. So healthcare, as such, like I said, is going through a huge transformation, which perhaps what very akin to what a banking went through a decade ago, right? Because this is that phase where all healthcare providers are looking at deploying technology so that they can make their patients access to healthcare seamless. When I say seamless, it's about making sure an access to a healthcare service is available to all their patients almost anytime, anywhere, right? Because and that is definitely delivered by using technology and across multiple channels. When I say channels, it's because you could use a mobile app to do it. You could use our websites to do it. You could reach out to a call center and do it, or you could walk into a clinic and do it. All of these places, I should be able to identify an Andrea as she walks across these channels and across our verticals. At Aster, that's what we are trying to work on. We are working on is to ensure that whether you walk into our clinics or you walk into our hospital, walk into our pharmacies, walk into our labs, I'm able to identify the same Andrea and able to address the requirements.
Talking about identifying the Saint Andrea, for example, um, in healthcare, patient data is extremely confidential, sensitive, so cybersecurity here is crucial. Could you tell us more about Aster DN cybersecurity strategy, what big projects are on place, and if we can know if there is any IT vendor with whom you are working on this strategy?
Uh, you're right. So compared to any other industry and compared to any other data, the patient data and patient health record is extremely confidential and extremely private. There cannot be any more private information than your own health details, right? So
And bank
yes, so
account.
bank, yes, and worst case, I'll just it's not that it's not serious enough, but worst case you lose some money when it's banking, but when it is health, it's your life that
Very
matters.
true, very true.
So it's like it's very 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 that's one way to look at it, so that you are you are extremely cautious and careful when dealing with patients' health records. And that's the message that's the kind of awareness and training that we do to our employees and all our care providers within a hospital, so that they take care of the data in such sanctity and such careful ways, so that we don't compromise on the safety of the patient data. So at Aster, we have ensured that we do the necessary awareness, because the most important uh, aspect of cybersecurity is to ensure that your internal teams, all your employees, all your key players who handle data are taught how to handle it safely. Because it's no secret that you look for any reports out there, the biggest vulnerability or the most frequent case of data compromise happens from within the system. And that does not happen with any malicious intent. That happens with ignorance. Which is why it is important that you continuously tell and teach and drive that message across to our employees and our key
Very true.
stakeholders, saying that, you know what, you're dealing with patient data. You're not supposed to talk about it with others. You're not supposed to speak about it when you're in the lift. You'll find if you go to hospitals, there are enough messages and signages that inside a hospital that accentuates that actually drives this message home. So that's the whole awareness piece. On top of it, uh, the technology team and my information security team continuously have been working over the last 2 years. It's a journey. All of these is a journey. You cannot just quickly turn around two taps and two switches and get everything safe.
So your
And
employees already have some training in terms of cybersecurity awareness.
yes, our employees have training, and we have deployed a solution as well, uh, that that uh, consistently trains. Because a training is not about putting a few slides together and getting people into a room and training. A training solution has been put in place that continuously sends, not just trains, but simulates environment. uh, so it might be a case where I would simulate that an email to all my employees, and see how many of them actually clicks on that and get succumbed to a phishing attack. So your vulnerability could be exposed by somebody clicking on a link which is malicious, somebody going to a site which is malicious, which is where should not have gone, somebody putting a USB drive into your system which is malicious. So all of these gets simulated, all of these gets tested with these trainings and simulations. So that's one of the big ones. And apart from this, there are several solutions deployed, like standardizing on antivirus, data loss prevention tools, hardening your firewalls, your web access firewall, and so on. But let me be very, very careful saying this, is that this is a continuous journey. I am sure no CISO or no CIO can say that, oh, I'm all done, I'm all safe. That never happens, right? The only thing that's only possible if you shut yourself into a room, close all the windows and doors, and sit inside. That's not the case when it comes to healthcare. You have to make the data available to the people. You have to share the information and data, because that's all healthcare about. It's not about holding on to the data and not letting it be shared with the doctors and the practitioners. So healthcare is again very unique here. Is that one, because the data is very, very important. Second is the data has to be shared and as with as many people as possible, so that is used to cure the patient and make the patient well, so that he can leave the hospital. But at the same time, you have to ensure all the safeguards are in place so that the data is safe.
Well, many congratulations for all the awareness lessons you are giving to your employees. I think every company should be doing that, because I don't know about you, I get phishing emails all the time, mostly every day. So sometimes it's so easy to click on, and we are talking about I mean, your job and hospital healthcare, it's the most important thing. It's super sensitive. And also, we were discussing how important data is. I wanted to ask you, Vinit, Is it time to expedite the adoption of the public cloud for healthcare providers?
I believe yes, because public cloud or private cloud, cloud yes, and whether it is public or private perhaps depends a lot on the company and the customer and the client. I guess I would say we've been on public cloud we are on a cloud for strategy. We use public cloud across the countries that we operate in, wherever it's available, whether it's India or whether it is the UAE. And we, I would definitely encourage more and more people to look at public clouds and put their solutions onto the cloud, because that is the only way you can actually scale and scale well, right? I don't believe the cloud, the switch to the cloud or adoption to the cloud is nothing to do about just saving costs. It is not. You might end up seeing that it is a fractionally little costlier than what you were thinking, but the benefits that it brings to table is much higher, and it's all about how you can make your business more nimble so that you can react well. So when you do well, you should be able to increase your resources, and when you are not doing so well, you should be able to reduce your resources. So that's how you should be able to run the business, and that infrastructure flexibility comes with cloud.
Also, we need Novartis Aster sign a memorandum of understanding for boosting digital transformation and clinical research. Could you explain to us more about this partnership?
Yes, so we are working with many such partners. Novartis is one of them, and this specific MOU was to work with them for clinical research. We across our uh, verticals and across the uh, various countries that we operate in, we have access to multiple patient data, patient information, and various kinds of disease patterns and so on. So Novartis and companies like Novartis come with a lot of research, a lot of expertise in research. And instead of we having to reinvent the wheel, we believe it's important that we work with partners like Novartis. And that's what this MOU is all about. And I'm sure it will go a long way in overall helping the mankind.
We know Aster DN is doing great. We know how much the company is investing for the future of the healthcare for your patients in digital transformation. But from your perspective, how do you see Aster DM in the region, like not only the UAE compared to other hospitals in terms of digitalization?
I believe Asta, he's been a leader in this region and in India and most of the areas that we operate in. For instance, we are the first private hospitals in UAE to be having given a HIMSS level 6 accreditation. HIMSS level 6 accreditation is actually about where you get it only when you automated all your processes within the hospital. So this is what makes me proudly state that yeah, we are right there as a leader. But this is a continuous journey because the technology around you is changing, the environment is changing, and most importantly, what we have done is we have ensured that we put together our foundations right, done all the things that are strong enough so that we can then scale from there. Uh, I keep saying that unless you bake your cake hard, you cannot put the icing on it because otherwise the icing will top off it and the cake will crash. So that's we've been consistently doing all the things right to get the foundation strong, and therefore we are now good to launch ourselves whatever happens around in terms of the ecosystem and the environment.
Vinny, thank you so much for your time. Thank you for sharing your lessons learned to talk about digital transformation in the healthcare here in the region. Thank you. Thank you so much.
It's a pleasure. Thank you so much. Pleasure is all mine, Andrea. Thank you so much.